Well, the more commonly used treatments and the ones that have been shown to be most effective include behavioral treatments, which is what I specialize in, and also pharmacologic interventions. The use of medications can be also very effective. Well, ideally, treatment should be based on what are the causes of behavior. And we do have assessment technologies that permit us to identify what aspects of the problem behavior seem to be more biological and what seem to be more related to environmental variables or learning history. So in an ideal situation, you would have an assessment that identifies what's the nature of the problem, and then treatment is directed at those causes. Sometimes the more mild forms of problem behavior may come and go, and it may be depending on what's going on in the environment in the child's life. In other cases, the problem behavior may be addressed only through intensive treatment. And in some cases, the individual may need multiple courses of treatment. Well, what most parents do is the initial point of contact for problem behavior is usually the pediatrician. And in some cases, if the behavior is not that severe, if the pediatrician has experience with medication, he or she may prescribe medications to address problem behavior. If the behavior is more severe or the pediatrician doesn't have experience dealing with that, he might make a referral to a psychiatrist. And the selection of medication, again, or the decision to use medication, I think, should be based on an understanding of why the behavior is occurring. So medication would be very appropriate if there is a psychiatric condition, if the child has mood instability or anxiety, something of that nature that can be best addressed with medicine. But if the problem behavior is more related to the environment, is just not well suited for that child, then a behavioral intervention that targets changing the environment may be appropriate. Or if the child has significant skill deficits that put them in a position where they are frequently frustrated because they can't communicate their needs, they can't make choices, then again a behavioral intervention may be more effective.
That's true.